Hello, I'm Paul Peterson. Increasingly, studies are showing that regular dental care is vital in assisting older adults to maintain good nutrition and health. But getting to the dentist can be a problem in and of itself. Today, we'll be looking at a mobile dental service that allows homebound seniors to receive treatment in the comfort of their own home. Stay tuned for Aging in L.A. While none of us look forward to visiting the dentist, we realize the importance of it and try to go regularly. This can be difficult for those that are homebound. Today we'll take a look at home care dentists in action as they provide treatment to a patient who lives in an assisted living facility. Recognizing the need for dental care for those who cannot get to a dentist, Dr. Kevin Worthen came up with the idea of taking services to patients in their own homes. Oh, Kevin, thanks so much for joining us.
Thank you for
This
having
is
me.
a treat because I'm one of those people that suffered because of the lack of your service. How did you come up with this wonderful idea?
You know, my father developed Parkinson's disease and dementia, and I saw that he couldn't get out of the house to, go to a podiatrist or go to any medical visits. And so I thought, this is something that I don't see any dentists doing it, and they're not really teaching it in dental school. So part-time I started doing it, and I found out that I really loved doing this type of work, and people really needed it.
Well, in a way, you become like a first responder because you can identify other issues in a senior's life that may need attention.
Exactly.
And perhaps tip off the caregiver or maybe the authorities if the need arises. But let's try to explain to our audience why oral health is so important. I guess the formal term is a periosystemic link.
Periosystemic link.
How is oral health and general health connected?
Especially with insurance, we separate the body from the mouth.
Yeah.
And a funny article by the Reader's Digest in 2005 said, now that we have reaffirmed that the head and body are indeed connected, it's like, well, we knew that, but we just don't address the oral issues thinking they're going to affect you systemically. But for instance, aspiration pneumonia, the #1 cause of that is the patient's own bacteria from around their teeth being aspirated.
Yes, exactly, getting into the lungs.
Exactly, and during the winter months when the flu season, that's when most people actually pass away from pneumonia. And a lot of it's caused by their poor oral health.
Right, and pneumonia stalks older people, especially homebound or shut-ins, or people who have suffered, for example, a hip fracture and are no longer mobile.
Exactly.
Of course. Well, I can see the connection. It wasn't so very many decades, well, a couple of centuries ago. In fact, the leading cause of death was all connected ear to jaw to throat. That's how people died. They got these infections that killed them.
Right.
Is it because an examination of the mouth is such an intimate procedure?
That's part of it.
Yeah.
I think, again, the older population looks at teeth and dentures as kind of going hand in hand. That you're going to lose your teeth as you get older, and you're going to need dentures. But I've actually had 102-year-old patients who've had almost all their teeth.
Wow, 102.
So, obviously they're doing something right. Getting cleanings regularly, flossing, and all that we do recommend. But a lot of people don't think it's necessary. They're like, every day I hear someone say, well, I'm 95 years old. Why do you want to, fix my denture? Why do you want to put a new crown on? Because, for one thing, you might live another 5 years, and you want to be able to enjoy your food on top of getting better nutrition from eating properly.
Right. Well, what do you think is the #1 issue with our seniors, particularly those who have stopped visiting their dentist regularly? What pops up most often?
Access to care. The ADA, the Dental Association, actually came out with a study in '02 that said people with disabilities and the elderly have trouble accessing dental care.
Yes.
And there's lots of reasons. They lose their dental insurance typically.
Right. You mentioned that to me before we started the show, that when you retire, like the first plan that you're out of is the dental plan.
Pretty much, and so they can't afford the care. And Medicaid doesn't reimburse for all types of treatment. So then they don't go. Other people who can afford it, they can't get to the dentist. For instance, an Alzheimer's patient, it may take 20 minutes to get them in the car. By then, they're already agitated.
Yes.
And then to go to the dentist, they have to sit there and listen, which no one likes to do, listen to the noise of the drill and all that. So they end up not going.
Right. And of course, a patient must cooperate in their own therapy or in rehabilitation. And just think of a lifetime of brushing our own teeth.
Right.
How difficult for an Alzheimer's patient in their confusion to let someone else brush their teeth.
Exactly.
It's challenging for our minimum wage staffs in nursing homes.
Right. And there's a few solutions to that. I mean, one obviously is to have the dentist or hygienist come in and do a cleaning. Our most frequent recall, our most common recall is 3 months. And actually that's how long it takes for the bacteria in your mouth to regrow to basically a toxic level.
I see.
But then we can actually go in to work on the patient, and they're more comfortable in their own environment. But also we teach the caregivers how to deal with them and how to slowly tell the patient or let the patient know that they're there to help them.
Well, and see, part of this is really essential. I can understand people first being reluctant to get into such an intimate area,
Right.
but it's often hidden. Our dear Auntie Ruth, in a facility for 2 years, and it wasn't until a front tooth fell out
Right.
that my wife and I went, wait a minute, what's going on here? And did the examination ourselves.
That's the most common thing that I see, is that either the parent was taking care of themselves for years, and maybe the past 2 or 3 years they haven't been able to do their own affairs completely. They don't go to the dentist.
Well,
or the front tooth falls out and their son or daughter says, well, now mom doesn't look good. But the back teeth are often missing by then.
Of course. And also, if our dentition isn't in good shape, we don't eat as well.
Exactly.
It becomes very challenging to eat, and so food doesn't taste so good, or it's too much of a burden. And if you don't have good nutrition, well, there's a sure way to lose your teeth.
Yeah, the nutrition is lacking, the ability to chew through food completely. So you have stomach problems, intestinal problems, because you're not digesting the food. And then our taste buds, we lose the taste buds, some of the taste. Medications dry the mouth out. So we want to make sure the patient is, able to chew properly, and there's might be an unseen problem, like under a denture, a sore spot, that they don't even really feel until they chew, then they forget about it. So the exam is very important.
Right, and I can see this. This is a wonderful new business. I was so excited when I heard about it. I had just come from a discussion of in a survey I will quote later about the alarming statistics of the lack of dental care for our senior citizens.
Right.
And there, all of a sudden, I met one of your compatriots, Glenn, and when he said you had this business model, I was excited because I know it's needed. I lived this.
Yes.
So how does this, do you recruit other dentists to come and get the same dose of joy you get?
Exactly. Yeah,
Really?
we have we have assistants and other dentists. We even work with like a house call hygienist. That's they call them extended function, so they can go in without the dentist and actually do cleanings. So but we do a lot of education, whether it's of the patient, the family, or the facility.
Okay. Great. Well, recently, just speaking of that, we visited an assisted living facility where professional dental caregivers visited one of their regular patients. Now, Kevin, if you could describe what we're seeing here. Well, first, the facility, obviously.
Right. That's Dr. Desai and Diana, one of the assistants, and our dentist walking in. That's a typical room. We can do the work while they're in the wheelchair. Oftentimes they're in bed or in an easy chair, a recliner.
Right. Now, this particular patient presented some challenges because of her difficulty in hearing.
Right. So we know how to work with the patient. We work slowly. If the patient needs us to write things down, but you can see she's opening and cooperating fully, so she knows what's going on. You're not going to do that unless you feel comfortable with the people.
Well, even with Alzheimer's, you're still apt to remember going to the dentist at age 12.
They do. Everyone does remember that. When I put my coat on, they help.
Yes,
they help with work.
It's remarkable. And of course, many other things come to light, as you mentioned earlier, during an examination that is this close and personal.
Right. You know, the person, you have to feel comfortable with someone who's in your mouth. I mean, that's why people keep their dentist for so many years.
Tell me about this equipment. It looks rather traditional, and yet it's compact.
It's basically one dental operatory that was developed for the military, and there's compressor, suction, water, all in one unit. We have an X-ray unit that looks like a radar gun, like the police use. But it's basically, like I say, it's one operatory that we can bring to you.
That's
you don't have to
fantastic.
come to the operatory.
Now, I would imagine that we were wired up, so you have things in the computer, and
Exactly,
you can come
yeah.
back and visit a patient and let the caregivers know that it's time to come again. Look at this kit.
Yeah.
This is such a compact kit. That is fabulous. I'm so impressed. What did the military do to downsize these things? I mean, I can remember big X-ray machines and stuff.
Basically, I think it was after the military. You know, the military, you know, they can spend more money and use a bigger equipment. But
Yes.
there are probably 40 or 50 companies that sell portable equipment of different types, from compressors to X-ray units. And they downsize it, you know, mostly with changes in computers and electronics.
Right. Now, there are certain things. We can't pretend like this is a full-on dental office. There are a couple of procedures that would be very difficult to do in a patient's home.
Right.
What would they be?
Root canals and extractions. You know, we do some extractions, but the root canals, you have to take a lot of X-rays, and typically one other thing that happens when we get older is the nerve shrinks. So quite often there's no nerve to really clean out, even if the patient's having a toothache.
Wow, I didn't know. I didn't realize
So I
that.
send the patient to the specialist.
I mean, I know about getting shorter, but I didn't know that.
Well, some people don't even want anesthetic because they don't feel the work. Like as you drill in
Really?
to do a small filling, they don't feel anything because the nerve is gone.
Wow, I'll be darned.
Yeah.
That's fascinating. Well, what about anesthetics? Can you bring anesthesia
Oh,
as
yeah.
long as well if the procedure calls for it?
Correct. We have topical anesthetic and the regular injectable anesthetic.
Wow.
If needed, say for a crown, or obviously when we do an extraction, you need a lot of anesthetic.
Wow. I just can't get over how pleased I am that you're here and that this idea exists. Now, how do people get in touch with home care dentists?
Well, we have a website, and that's homecaredentist.com.
Okay.
And also our 800 number is 800-382-3938. And you know, you can send in a request via the website also.
Wow, that's good. That's good. But and you do cover Southern California,
Oh,
right?
yes,
This is
yes.
not only Orange County and San Diego County, but Los Angeles County
Yes,
too.
we do come to Los Angeles County. Yeah.
Well, I can just see caregivers right now scrambling for a pencil. So let's repeat this again. The telephone number again, please.
It's 800-382-3938.
Okay, and the website is Home Care Dentists, it's plural, right?
Yes.
And .com.
Yes.
I know that there are caregivers out there sitting there going, I've got to do something about my mom's breath.
Right.
I know she's been having trouble chewing. So, look, pick up the phone. Get some information about this. Now, how do you bring all of this equipment to, I mean, do you come like in a bus or something?
Well, you know, the competition I saw years and years ago was a motorhome. You know, but the patient would still have to go to the motorhome. So I decided to get a small car. This time, now we're using Honda Elements. All the equipment is put in the back, and we just offload whatever we need for that patient. It might be just one box. It might be half the van. And so we bring it into the patient's room, or say an office. Some facilities have medical offices or dental offices in the facility.
Well, the design, though, for me, of the business is so elegant. We ask our seniors to stay in their home longer. It's better for them, more cost-effective. And here's a service that can come directly to you.
Right.
It's such a wonderful idea. Now, what about, can you visit major facilities where there are several seniors?
Yes. I mean, that's the ideal, you know, for us, is to go to a large facility, maybe assisted living, that has 100 people, and then we go in and do 4 or 5 people each visit.
Right.
We try to go back every week to each building that we
Makes
go
sense.
to.
And it gives you a chance to educate the staff, doesn't it?
Exactly. Because that's the biggest thing. No matter what we do, if the patient's going to forget how to take care of themselves, the staff has to know. So we try to introduce everyone to the proper oral care for this population.
It's really, it's important what you're doing. Again, homecaredentist.com. It's time for a short break. When we return, we will continue our discussion of home dentist with Dr. Kevin Warthen. Please stay tuned. We'll be right back.
In the aftermath of a disaster, You may not be able to rely on your knowledge of your home. You might also not be able to rely on your guide dog. The dog may be injured, frightened, confused, panicky. Be prepared to calm your dog and to keep it confined and securely leashed and/or harnessed. For additional information, please contact the Department on Disability or the Emergency Management Department by calling the numbers on the screen or by dialing 311.
As kids, it's really important that we learn the proper way to cross a street. First, you have to stop at the curve, then look both ways to make sure there are no cars. If you see one, wait for it to pass, and when it's clear, you can cross. As kids, sometimes you have to set an example. Look both ways before you cross. Cars can't see you.
Welcome back to Aging in LA. Our topic today, home care dentists. Please welcome our guest once again, Dr. Kevin Worthen, who has pioneered the idea of dentists visiting senior citizens at home. It's such a remarkably simple idea. You must sometimes feel like somebody gave you a tap on the shoulder and said, this is yours, buddy.
Exactly. You know, one thing I think I mentioned to you earlier, that when people go to the dentist, a lot of times the first thing they say is, oh, I hate the dentist. Nothing personal.
Yeah.
But you know, I really got a lot out of working with people that wanted to see me. You know, they're like, thank you for coming.
I'm sure. And for some patients, especially elderly patients, they don't want to be burdensome. They don't want to put their caregiver to a bother. So maybe they haven't disclosed fully. And your visit may be their first opportunity to say, by the way,
exactly.
Even if it's to report abuse.
Well, exactly. You know, and I guess, well, not I guess, but obviously a lack of providing oral care, it can be considered abuse. You know, that you're not helping the patient have the best health.
Well, oftentimes, I'm sure, just speaking on behalf of caregivers, and I am one, that's kind of the last thing you think about.
Right.
You know, you worry about whether the food gets to the mouth and sort of the personal hygiene aspects of things. But I remember how startled I was that Auntie Ruth, who prided herself on her wonderful teeth, all of a sudden was losing them. And I thought, I failed some here. I should have known better. Right. So what's a caregiver to do? What are some of the signs they should look for, assuming the staff hasn't picked it up?
Well, initially the staff, you know, we like all facilities to do an exam when the patient goes in, just to find these things. But for a caregiver or a family member, staff member, if the patient's not eating as well, their dentures are clicking and clacking. You know, even if someone who has dementia or some mental disorder, they become more belligerent.
Right.
Or they're more vocal, or just not eating like they used to. I mean, those are all signs that there could be something going on in the mouth.
Well, they could have a pain in their mouth, for that matter. And you look, it drives animals crazy. It drives us crazy.
Right.
If we had persistent and grinding pain. So now, but how would a caregiver? Well, what if you think it's staff inattention? Is this something that you sit down with the facility director and say, look, let's talk about this for a minute?
Yeah, we do lectures on oral care, how to provide oral care for people. You know, we'll go in and do a lecture with a PowerPoint, have all the staff members there, and then when we go in for each visit, we talk to whoever takes care of that one patient and let them know this is what you're not doing and this is what you should be doing.
Right. And are you able to do that in visiting a home as well? I mean, you know, leave off like a checklist or a brochure or something?
Yeah, we have you know, informational forms that we give out. Our website has all the information and more that we would tell someone in person. But they can always reach us also if they have questions.
Right, and we gave out that 800 number, and I hope you guys all copied it down. I'm going to repeat it one more time. Once again, the 800 number is?
800-382-3938.
Okay, that's the number. Of course, the funding and the money is always going to be an issue here.
Right.
And the fact is the insurance industry and health care generally is lagging way behind in this. Yeah. What is there adequate compensation for this kind of care, or is this going to come out of somebody's pocket?
You know, unfortunately, it does come out of their own pocket. There are provisions made. You know, there's a company called Care Credit that the patient actually pays Care Credit as if it's a credit card.
I see.
And it's a health care only card for medical, dental, veterinary even.
Wow.
And so that's, a lot of our patients use that type of system to pay us. You know, our fees are comparable to a fixed office, but if the patient can't afford a fixed office, then they can't afford any dental care.
Well,
you know.
exactly, and this provides at least that alternative because, and I would appreciate the fact that there can be additional expenses here for being mobile, but gosh, the return on this, just for quality of life,
Right.
you know, peace of mind, this is important. But you mentioned to me earlier about taking care of someone in their backyard so they could brag about having their dentist at home.
Exactly. You know, I mean, we can go anywhere, you know, and this person was one of my first patients, and he wanted his crown done in his backyard. So, but we prefer, you know, in the house.
No,
you know,
of course. Of course. That makes a lot of sense. What are some of the, what kind of changes would we have to make to our state-run insurance system to accommodate these, what are increasingly necessary home visits by qualified dentists? What would we have to change?
Unfortunately, the biggest problem is funding. You know, there are programs in all states that provide for dental services, but usually they reimburse so low that even in an office, they don't pay for the procedure.
Right.
Yeah.
And that doesn't take into account, forget the years of training that you had to go through to become a dentist, but this cannot be inexpensive to equip a Honda Element with the tools that you would need on these visits.
Correct. And one thing people don't consider, I didn't consider at first, is that things expire more rapidly when you're driving around in a car and it gets 120 degrees inside.
Yes.
So we go through
right.
more supplies
Sure.
and more equipment and a gas cost, of course.
Right, well, yeah, that was a pretty dramatic blow for everybody in
Yeah.
America. It's like, because I remember 25-cent gas, you know, and 4.50 was what?
Yes,
Just
yes.
startling. Well, that's another area to deal with. But is there anybody pushing legislation on a state or national level that can include services like yours?
You know, truthfully, I have not heard of anyone who's doing that. And I think I've thought of it, but I don't have the background to know how to approach someone.
Well, I can say with some authority that I have actually passed more laws than our next president. So, but this is something that should be done.
Right.
Especially in our mobile society. You tell me, working in Las Vegas, it's the same sort of spread out, ever-growing population
Exactly.
base. It's hard to chase them down.
Yes, yes. You know, and one thing you were talking about, insurance companies, and in fact, some insurance companies now are offering extra cleanings for people who have certain diseases. Well, not always diseases, but pregnant women, for instance, that there are more low birth weight and preterm babies delivered. They found that if you do extra cleanings, their insurance companies actually save money. They don't have to care for a preemie. Now, with the elderly or anyone who's not an infant, diabetes is one of the biggest connections. It's, you know, with periodontal disease and diabetes control, it's back and forth. You lose bone when you have bad diabetes,
of course,
but also you can't control your blood sugar level if you have bad periodontal disease. So they're offering extra cleaning, some of them, for people with diabetes.
And in the end, it's a cost-saving measure.
Exactly.
Well, see, I often wonder about that. It's funny how we run our lives and we teach our children, you know, to take care and exercise a little bit of caution because the consequences of not doing so are so grave that you learn this lesson. And yet here we are. We've got these big systems that they're penny wise and pound foolish,
Exactly.
darn it. And I can see where you could actually get a team of people. Now, you mentioned a motorhome where they have to come out, but how about, you know, coming to a rather large facility with several dentists and get it all in one fell swoop?
Exactly, exactly. And a lot of facilities are being proactive in putting a medical, you know, physician's office in their facility.
Right, and that's smart to do. You know it's going to be used. You know it's going to be used. Well, what about rural America? How far out? Is there a mileage charge? Is there a distance thing? Have you encountered that?
You know, for us, you know, our headquarters is in Orange County, so that's where all the bands start in California. And of course, as you mentioned, I'm in Las Vegas area. So if the further we have to go, the further it takes us from our other patients.
Right.
So we do have not a set fee, but we do have to charge a little extra for distance.
And it makes sense. It makes sense to do. Gosh, I wish this was a national service and you do like FedEx, you know, and headquartered in Atlanta, but we'll be anywhere.
Right.
That would be great. Now, you mentioned that people can go online and actually make appointments for this service?
They can contact us, and we're working on the actual appointments, and obviously there's a lot of information we need before we work on someone.
Certainly, of course.
And I look at the patients that I work on that I know more about them than when I worked in a fixed office, because they have medical charts, they've been to the hospital, they have the family members, they have their own memory. So we get a lot of information before that first visit, and so we can't just like that go out until we get enough information.
But that makes sense. That's professional quality care, and I just know there are caregivers out there right now saying, thank God we heard about this. Unfortunately, our time is up for today's Aging in LA. Our thanks, sincere thanks, to Dr. Kevin Warthen, who came up with the idea of, get this, having dentists visit their senior patients in their own homes. Ah, thank you so much, Dr. Warthen. And now, it is time for today's Senior Stat Shots. And again, we found today's statistics in the recently released LA County Seniors Count, a survey of the older adult population in Los Angeles City and County. Today's statistics reflect the health needs of senior citizens in Los Angeles County. When it comes to insurance, 61% of seniors do not have dental insurance. 14% do not have medical insurance or an HMO. 47% of LA County seniors do not have prescription drug insurance. When it comes to affordability, 9% of the senior population needs but is not able to afford medical care. 18% need but cannot afford dental care. 9% of the seniors in LA County need but cannot afford prescription drugs. 13% of our seniors need but are not able to afford vision care, such as glasses or cataract surgery. And 11% are not able to afford hearing care, like hearing aids or implants. And thinking about seniors in Los Angeles County, having prevention services, 31% of the senior population has not had a dental exam in the last 3 years. 33% have not had a flu shot in the last year. 51% of our citizens over 65 have not had a pneumonia shot in the last 10 years. And 22% of LA County seniors have not had a physical exam in the last 3 years. My friends, these are shameful statistics. We're going to have to do something about this because the cost will be extraordinary if we don't get a handle on it. And that's today's Senior Stat Shots and my opinion. Now, you can get your own copy of this fact-filled survey. Simply go online to www.ladcss.org, which is Los Angeles County Community and Senior Services. Click on LA County Seniors Count, and the full report will appear. Or you can have a copy sent to you by calling 213-738-2065. That's 213-738-2065. I'm Paul Peterson, and for the Los Angeles Department of Aging, the people here at City View Channel 35, and all of our guests on Aging in LA, thank you so much for watching. We'll see you next time.